no end to COVID woes in the national capital. Delhi Chief Minister Arvind Kejriwal has said that the national capital has reported more than 24,000 new cases in the past 24 hours. The positivity rate is extremely high. This incidentally is the single highest day surge since the outbreak of the pandemic. Arvind Kejriwal then went on to say that the capital too is running out of beds, oxygen cylinders and the Remdesivir injection. He went on to appeal to the centre to reserve at least 50% beds even in central government hospitals in the national capital for COVID patients. Earlier in the day, Delhi Chief Minister Arvind Kejriwal was scheduled to hold a review meeting of the COVID situation along with Deputy Chief Minister Manish Sisodia and the Health Minister Satyendra Jain. Delhi witnessed the first weekend curfew imposed yesterday, will be in place, imposed last night at 10, will remain in place till 6 in the morning on Monday. Only essential services are permitted on the road. Hotels, spas, gyms are closed. People who are scheduled to attend weddings will be given e-passes for movement during this curfew. But Arvind Kejriwal is sounding the alarm on shortage of oxygen, on Remdesivir injections and hospital beds.
किसी भी हेल्थ इंफ्रास्ट्रक्चर की एक सीमाएं हैं। दिल्ली के अंदर भी सीमित बेड्स हैं, दिल्ली के अंदर भी सीमित आईसीयू के बेड्स हैं। जिस तेज़ी के साथ कोरोना बढ़ रहा है, जाहिर है कि एक सीमा के बाहर आके हर हेल्थ सिस्टम की एक सीमा होती है। तो बेड्स बहुत तेज़ी के साथ, जो ऑक्सीजन बेड्स हैं, जो आईसीयू बेड्स हैं, बहुत तेज़ी के साथ ख़त्म होते जा रहे हैं। लेकिन आपकी सरकार पूरी कोशिश कर रही है कि बेड्स को और ज़्यादा से ज़्यादा बढ़ाया जाए। अब दिल्ली के अंदर ऑक्सीजन की कमी होने लगी है, रेमडेसिविर की कमी होने लगी है। आज मैंने काफ़ी लंबी एक चीज़ के ऊपर मीटिंग ली थी सभी ऑफिसर्स के साथ। तो जो हमारे 3-4 दिन पहले हमारी असेसमेंट थी, चूँकि केसेस बहुत ज़्यादा तेज़ी से बढ़ रहे हैं, इस वजह से इन सारी चीज़ों की कमी भी, जो हमें लगता था कुछ दिन पहले तक की स्थिति ये चीज़ें उचित मात्रा में मौजूद हैं। आज ऑक्सीजन की, रेमडेसिविर की और टोसिलिजुमैब, इन तीनों की कमी नज़र आई। पिछले 24 घंटे में दिल्ली में लगभग 24,000 केसेस आए हैं। ये रिपोर्ट थोड़ी देर में अभी जारी होगी, जो डेली बुलेटिन जारी होता है। पिछले 24 घंटे में 24,000 केसेस आए हैं। उसके पिछले 24 घंटे में आए थे 19,500 केस। तो आप देख सकते हो कि एक ही दिन के अंदर केसेस 19,500 से बढ़ के 24,000 हो गए हैं। पॉजिटिविटी रेट 24% से ज़्यादा हो गया है। तो स्थिति काफ़ी गंभीर है, चिंताजनक है।
The situation is grim, says the Delhi Chief Minister. 19,500 cases day before yesterday shot up to 24,000 cases, an increase of almost 4,500 plus cases in 24 hours. Milan, is Delhi getting overwhelmed? Is that the problem, that the Chief Minister sounds this alarm about a shortage of Remdesivir jabs and also oxygen and beds?
Yes, Gaurav. In fact, a jump of 24,000 cases in the last 24 hours is a huge alarming figure for the national capital, even as the curfew and restrictions continue today. And in large parts of Delhi, people were seen following them. Delhi's almost deserted streets at this point, but the positivity rate has jumped beyond 20%. The central government is being appealed for not just oxygen and Remdesivir injections, but also we've done a ground check to find that there are no supplies for Favipiravir or Fabiflu medicines either in Delhi at this point. And that is a concern that the Delhi CM has raised at this point, and therefore he's appealed to the centre that they require more oxygen beds in the hospital. It's a hell of a task to look for any ICU or ventilator bed in any of the hospitals in the national capital right now. And that is why the number of cases that you can see have increased so much that hospital infrastructure, medical infrastructure, and medicines, in fact, are unavailable at this point in the national capital. Not just Remdesivir, Gaurav, but Favipiravir and medicines like Ivermectin are also unavailable as they are out of stock in pharmacies, and doctors continue to prescribe them to patients.
Okay, stay with me, Milan. I want to bring in Rahul Srivastav on the shortage of oxygen and Remdesivir. Rahul, is this poor planning? Is this poor coordination? Or is there merit that the cases have spiraled so much that neither the center nor the state anticipated this spiral and did not cater to an increase in demand both for beds and for oxygen?
Gaurav, if you look at it, we have been discussing this with a lot of people in the system, stakeholders, scientists, epidemiologists, and others. What it seems that the lull which appeared, the decrease by the time it was January, early February, it seems everybody got lulled into a sense of comfort. And there was a lack of a scientific temperament to have built on this period of relief. Why I say that this was a period when cases were going down, Remdesivir stocks could have been built, oxygen supplies could have been created, stocks could have been created, beds could have been created. Say, for example, when Delhi Chief Minister says that at one time the central government had given an X number of beds and today they are much lesser. But why is it that the state government and the center didn't coordinate? Say, for example, oxygen, Gaurav. Very sorry picture, Gaurav. India produces something close to 7,000 MT of oxygen regularly. The consumption is close to 5,000 something right now, means 54%. 46% was spare available in the system, but in Maharashtra it is produced, it is consuming the same amount. In some states like UP and Madhya Pradesh, it produces nothing, demand is very high. In some states where it is produced in large number, less demand. There was no coordination between the state and the center. Why wasn't Maharashtra ready for demands of Remdesivir and oxygen and others 2 weeks back? Why weren't letters being fired to the center that there could be a spiral? When it comes to one point I like to make, Remdesivir is being talked about as a shortage issue. On the 10th of April, the Director General's Health has written a letter to 6 companies that Maharashtra and other states should be the focus areas. Cases are going up. Now, why wasn't this whole thing acted upon? Gaurav, I think politics took over, blame appropriation and others took over this entire exercise of battle against COVID, and that's what is hitting the people.
You know, before I bring in Milan and go on to the other big story, I just want to understand, is it the center's job to arrange for oxygen for states, or can states reach out to other states and get oxygen? Rahul Srivastav.
Gaurav, see, oxygen is not a centrally controlled commodity. Now the issue is that private hospitals do get and they procure from all over. In fact, if you go to Amazon and others, you've got a lot of devices which deliver oxygen and others. The point is not that, Gaurav. This is a pandemic. Whether it is a state issue, whether it is a central issue, they should have been on the same page, as you said.
Absolutely.
They were on different pages. There are states which are not having elections. There was no coordination. There are states having elections where the center-state rivalry is at its peak. Who is supposed to? Now, the question is not whether center controls oxygen or not. Were there demands made 3 weeks back that there is a possibility in future of escalation in cases? Why don't you ensure more oxygen supply if it is available in Gujarat state? There were no letters flying. The issue is that all the government, center and state, it seems this time around have failed the people of the country.
They indeed appear to have. Rahul, stay with me. The director of the prestigious All India Institute of Medical Sciences, Dr. Randeep Guleria, is advocating lowering the age of vaccination. So he wants more and more people to be jabbed and as quickly as possible, so that plays a bigger role in securing our people against coronavirus. Let's listen in to Dr. Guleria.
we should gradually lift or lower the age bar so that more and more people come into the pool of people who can be vaccinated. And I think that will happen in the coming few weeks, because as we've just discussed, we will have more and more vaccines which will come into the common pool. And therefore, that will allow us to really open up the vaccination to a larger amount of our population.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.